A very good afternoon, all of you. I am Dr. Komal Chavan, Chairperson, Foxy Medical Disorders in Pregnancy Committee, and I bring greetings from the committee. At the outset, I would like to thank Dr. Alpesh Gandhi, President Foxy, Dr. Jaideep Tang, Secretary General Foxy, Dr. Niranjan Chavan, National Coordinator, who is instrumental in bringing this series of webinars, Dr. Atul Ganatra, my VP in charge, for always supporting and encouraging me. And this is our first webinar series on a most important topic, that is the psychological aspects associated with COVID-19 and untold first-hand experience unfolded, brought to you by together with the Foxy Committee, Science Integra, and our partners, Sun Division, Sun Pharma Divisions. So to begin with, a brief intro is that the corona pandemic is all over, and we as obstetricians, including doctors and our patients, are all worried about where we are leading to. And this scare has caused more concern to our elderly age group patients, our pregnant patients, patients having underlying problems, and even our healthcare workers are at risk. And lot of discussion after this 10 days of lockdown is happening upon the psychological aspects. And so this is our main step where we want to touch this aspect and clear all our doubts among our doctors and our fraternity. And so I call upon the moderator for the session, Dr. Niranjan Chavan, who is a professor and a unit chief of Lokmanya Tilak Medical Municipal College and Sion Hospital, having teaching experience of more than 30 years, who is currently a secretary of Mumbai Obstetrics and Gynec Society. He is Secretary General of Maharashtra chapter of IAG, Dean Chairman of Academy of Global Obstetrician and Gynecologists. He is also on the editorial board of the European Journal of Gynec Oncology, and he has a lot of credits to his and a lot of applauds to himself. So over to you, Dr. Niranjan, to take over and introduce our speaker for the day. Thank you.
Thank you so much, Dr. Komal Chavan, and I welcome Dr. Nilesh Shah, sir.
Thank you.
Thank you, Dr. Komal Chavan. I would like to welcome our speaker, Dr. Nilesh Shah. Dr. Nilesh Shah, sir, is a professor and head of the Department of Psychiatry in Sion Hospital and has an experience of 35 years in research, in academics, and in psychiatry. He is a pioneer in treating a lot of psychiatric disorders, and he is also one of the first psychiatrists to deal with COVID-19 patients. We are very lucky to have Dr. Nilesh Shah, sir, with us today. And recently in this COVID outbreak, when Sion Hospital had its quarantine hospital of 7 Hills, where more than 300 patients were presently quarantined, and following few days, they landed up with a lot of psychological issues. Not only patients, but their relatives, and also our obstetrician and gynecologists and medicines consultants, anesthetists, ENT, and all other departments had such an issue that he had a first-hand experience of this. Not only that, he is going to dwell on the topics of interesting how to go about and manage yourself from a psychologist point of view, and also for the patients, and also it will be helpful for the obstetrician. So the mic is yours, Dr. Nilesh Shah, sir. We have got more than 1,000 members online, and I'm sure in the next process of 1.5 hours, we will have many of them coming from all over the world to hear from you. This is the first webinar where we have got the eminent psychiatrist and psychologist and a great human being to be present amongst us and to guide us on this issue. So the mic is yours. Dr. Nilesh Shah sir, welcome to the series of webinars of medical disorders in pregnancy headed by Dr. Komal Chavan. And I would like to thank Science Integra and our sponsor Sun Pharma to get all of us together on this wonderful platform where we are all sitting at home or we are working as doctors, going to our hospitals, going and seeing patients, delivering them, doing cesarean sections. There are a lot of things which are happening around the world. We have just got tired of seeing that, the news again and again. It becomes like a score every day. It's increasing. There are a lot of issues. So I want and I request sir to go ahead and please start his speech and his lecture on psychological aspects associated with COVID-19. Thank you, sir.
Thank you very much, everyone. And thanks to your society and Sun Pharma and all of you for inviting me and giving me this opportunity to share some of my experience. Basically, the psychological problems, psychiatric problems associated with this COVID-19. I'll be sharing my experience, but please feel free to stop me at any time. And if you have any questions, if you want to interrupt me, please feel free to do so. Now, as far as our experience is concerned, psychological problems, we can group it in three groups. One is the fear which all of us have about COVID-19. The second is the problems which have come up because of this lockdown. Now you can't go out, you have to remain in the house, and that's why lots of psychiatric problems have come up. And finally, as you mentioned, that quite a few patients have been quarantined. Say, for example, in Seven Hill Hospital, and they have developed some psychological problems. So I think I will start with the normal fear. I think all of us are anxious, worried, and concerned about this COVID-19. And the fear is absolutely valid, and it's a normal physiological anxiety. Earlier, when somebody would cough and would say, "Gale mein khich, gale mein khich, kya karun?" And obviously the answer was, "Vicks ki goli lo, khich dur karo." So it was very simple. Nobody was afraid of if somebody is coughing. And now what has happened that if somebody is coughing and says, "Gale mein khich, kya karun?" So the first reaction is, "Mujhse dur raho," or "Corona ke liye test karo." So now that fear of having corona has so widespread that everyone is concerned. And to a great extent, I think this is a valid fear, and this is a normal physiological anxiety. All of us should have it. And because of that, we take certain precautions, and that is due precautions. Whatever prescribed precautions are there, we take because we are anxious, we are worried, we are concerned. So that's a good normal physiological anxiety, and all of us should be anxious and worried about this. Sometimes when the anxiety increases to such an extent that we get overwhelmed by the anxiety, where it becomes a pathological fear, pathological anxiety, what we call phobia or fear. In psychiatric terminology, we call it illness anxiety disorder or illness phobia. This illness phobia or illness anxiety disorder is not a new phenomenon. It has been there since very, very long time. Say in 50s, tuberculosis was a major illness, and we did not have many treatment options for tuberculosis except going to the sanatorium and staying over there. At that time, anybody and everybody was afraid of tuberculosis. And some of the movies of Raj Kapoor were related that he developed tuberculosis. Then came the era of cancer. And we had spate of movies related to cancer, like Anand, Safar, Akhiyon ke Zarokhe se. And in each movie, the hero or the heroine will develop cancer, and then they will cry, and then finally, Millie was another example. And at that time, everybody had developed a fear of cancer. So if somebody would cough or somebody will lose weight, they will think, "अरे मुझे cancer की बीमारी तो नहीं हो गई." So everybody was worried about cancer. Then came the era of heart attack. People became more aware about cardiac illness, and we started saying, eat less oil, then eat less sugar, now eat less salt, and do exercise, and anything little pain here, pain there, and people say, oh, mujhe heart attack to nahi aaya. And again, in movies, they started showing that the daughter runs away from the house and the father gets a heart attack. And then he's taken to the hospital, and the runaway daughter is told that your father is ill, please come back, and she comes back. Now, real life, this doesn't happen. But many people develop this phobia, illness phobia of heart attack. After that, we had a big fear of HIV, and we had large number of patients coming to us and saying, मुझे HIV की बीमारी हो गई, मुझे ये हो रहा है, वो हो रहा है, वजन कम हो रहा है. And now that same illness phobia has become corona phobia or COVID-19 phobia. So this fear is there, and nowadays we are getting patients who are either for themselves worried that they have contracted this illness, or their family members will contract this illness. I remember just one day before the lockdown, this lady came and she had severe panic attacks, and she was seen by a cardiologist in emergency. She was seen by medical people, and everything was normal. And suddenly she would get severe panic attacks. And when we asked that, what is the stress? And she said her son is working at this Seven Hill Hospital, and she came to know that many people have been quarantined over there. And that's why she started worrying that the only son would develop this illness, and then what will happen. And subsequently, we started getting many patients, many phone calls saying that should we get tested for COVID and what is going to happen. Particularly, specifically for pregnant women, I think it is very, very important for them to know that there is no evidence whatsoever that pregnant women are at a higher risk of developing this illness. So we neither have evidence that they are at a higher risk, nor we have evidence that they have a lower risk. So the risk for pregnant women, those who are pregnant, is same as non-pregnant women. So if you are pregnant, don't worry, you are not at a higher risk, and risk is not very, very high. Second, you can go through normal pregnancy and even normal delivery, and there is no problem. You can consult your gynecologist. They are better equipped to answer these questions. But to the best of my knowledge, even normal delivery can go on even if you have this illness. And to the best of my knowledge, it may not be transmitted to the child who is there. And there is no need specifically if you have COVID for cesarean section. So they are saying that even if you have COVID illness, you can deliver normally. Normal, full-term normal delivery can happen. And even after that, there are people who say that if you take regular precautions, like what we take, washing hands, etc., and wearing the mask, etc., you can breastfeed your children, breastfeed your newborn child. So I think that though normal physiological fear, anxiety, concern should be there, but if you have excessive anxiety, excessive worries, and because of that you are unable to sleep at night, if you have panic attacks, you are preoccupied continuously with these thoughts, as it happens in some cases, treatment is required. You can consult a counselor or a psychiatrist. And nowadays, consultation is available on phone. So whosoever is your family physician, your gynecologist, you can contact them and they can refer you to a nearby psychiatrist, and that psychiatrist will do a consultation on the phone. You even need not go to him, and he will do the counseling. He will reassure you that the risk is not very high and you need not worry about it. That is number one. Second, he will also prescribe some medicines if necessary. And also we tell them certain things, that how to kind of allay your anxiety by various behavioral techniques. So for example, for dental health, we brush our teeth every day. For our body hygiene, skin, to prevent skin disease, we take bath every day. Similarly, for mental hygiene, a very simple thing which we can practice every day is relaxation therapy. A very simple relaxation therapy. Many of you might know what is called as pranayam or savasana or transcendental meditation, any form of meditation which gives you relaxation. Even listening to a soft music may give you relaxation, or Jacobson's deep muscle relaxation therapy. So what you need to do, just lie down, take deep breath. If you and lie down like a dead body. So now in a normal state, if your respiratory rate is say 8 to 12 per minute, when you lie down and take deep breaths, you might be breathing only 4 times in a minute, and do it for 15-20 minutes in the morning, 15-20 minutes in the afternoon, 15-20 minutes in the evening, and that will give you lots of relief in anxiety. Similarly, the other things which you always wanted to do, like exercise, which you are unable to do, now you can do, you have time. Even in the house, you can do exercise. You can prepare a timetable of what all things you can do, or what always you wanted to do. You wanted to see certain movies, you can watch those movies. You spend time with the family members, and of course, extracurricular activities. For example, say I love my extracurricular activities is vegetable cutting. So when I am home, I help my wife with cooking. I don't give her direction, but whatever vegetables are there, I cut it for her and give it to her. So I do it in the for the breakfast, lunch, evening snacks, dinner. So I enjoy it and it gives me relaxation. So I think one of the first thing is, number one, normal physiological anxiety is valid. Everybody has it and it's good. And because of that anxiety, we take certain precautions, prescribe precautions, don't go out, wear a mask, wash your hand, etc., etc. We all know about it. If you have a pathological anxiety, please do relaxation. Don't overburden yourself with the information. There is an information overload. Everybody is telling you what are the different types of masks, and what are the different types of viruses, and what are their qualities, and how many people died in which country. Now these are not necessary. If you can, if you are comfortable with that, you read it. If you are not comfortable, don't overload yourself with unnecessary information. And practicing yoga, meditation, relaxation, extracurricular activities, virtual socialization on net, all these things will help you to allay your anxiety. The second problem which has come up is mainly because of lockdown. We see, because of the lockdown, very first day, we saw 4 or 5, 6 patients, in fact 6 patients of alcohol withdrawal delirium. Many patients have a habit of taking alcohol regularly, and suddenly, because shops were closed down, suddenly they went into withdrawal. So patients having alcohol use disorder or drug use disorder, people were taking opium, cannabis, benzodiazepines, sleeping pills, suddenly stopped getting these medicines over the counter, and they went into withdrawals. And so all these, it's a mild withdrawal, it can be treated on telephone, we can prescribe medicines. But if it's a severe withdrawal, you can visit your nearby hospital. All the hospital emergency services are going on. Science Hospital, KM Hospital, Nair Hospital, emergency services are going on. So please feel free to visit emergency medical services. The psychiatrist over there on call will see you and help you out if you are in withdrawal. Similarly, getting medicines has become difficult, and earlier telemedicine, prescribing medicines, consulting on net or WhatsApp was not done, and it was not considered legal. But now there are revised guidelines, and based on the present situation, people say it's okay to do the consultation on web or on WhatsApp or on any social media. So if you have to kind of consult your psychiatrist, your counselor on social media, please use WhatsApp, please use any other mode, phone, video calling, etc., and talk to them, and they will really help you. So because of lockdown and other problems, traveling problems, and for pregnant women, these are genuine problems. We were talking the other day, and suppose somebody is pregnant, full-term pregnancy is there, and she is waiting that for that day when the membranes will rupture and she will have to rush to the hospital. And if no vehicles are available, what she would do? These are genuine problems, and that's why I think they will have to, if they have their own vehicle, that's fine. If they don't have, they will have to use the vehicles of neighbors or relatives. They will have to keep in touch. And to the best of my knowledge, there is one ambulance service, 108. So people at any time in emergency situation can dial 108, and that 108 ambulance is provided by the corporation government, and it will come to your house and take you to the hospital. So keep plan A, plan B, plan C ready, so that whenever the emergency, when you have to deliver and you have to go to your doctor, gynecologist, you can reach them in time. So if you are very well prepared, that anxiety will be less, that in case something happens. And obviously there are many other problems which are faced by people. Say for example, couples undergoing IVF therapy, and now because of the shutdown they cannot visit. So please consult your doctor on the phone and find out what else can be done in this situation, and whether the appointments can be postponed for a few days, or what else they can do remaining at home. So I think your gynecologists and obstetricians will be in the best position to answer and give you guidance related to these problems which has come up because of the lockdown. One more problem which has come up because of the lockdown is sensory deprivation. For most of us who are staying with the family, it's a good family time, the whole family is staying together, but there are few people who are staying all by themselves, all alone. And earlier, going out, they were getting sensory inputs, they were able to meet their friends in person, etc. Now with total cutoff and they are not able to go out, some of the patients who have pre-existing psychiatric disorder, particularly those who are prone to develop schizophrenia, or those who are not getting the medicines, they tend to break down. And I heard of this case, patient in Tamil Nadu who was staying all alone by himself, and then he developed acute psychotic episode because of sensory deprivation, staying at home, probably even the medicines he did not get. So his psychosis worsened and he kind of started running without clothes on the road, and then he had to be restrained and kind of taken to the hospital. So these kind of instances which have occurred because of specifically lockdown and sensory deprivation in the house, people for the people who are staying all by themselves. So that's another thing which has happened. So in a way, lockdown has good effects as well as not so good effects. Good effects are many people who are chronic smoker are not getting their quota, so automatically no smoking, and that has helped them. And many people have realized that even without smoking, they can stay. And there is a psychological craving, physical craving, but they don't die. And they say, yeah, I have not smoked since 4 or 5 days. Craving is there, severe craving is there. I have tried Nico gums or nicotine gums or chewing gums or other things. But now I realize that I can manage without smoking, and many of them are determined that after this lockdown is stopped, they will not start smoking. So many of my friends, gynecological friends, other friends, suppose you have stopped smoking or stopped taking nicotine in any form because of the lockdown, please continue doing so. It is helping. It's a blessing in disguise that everything is locked down. You are not getting your quota of nicotine. Even when the lockdown is over and we are able to go out, don't start smoking. It's helpful. All of us say that smoking and use of nicotine is injurious to health. And finally, I must share my experience of people who were quarantined. Now see, on one hand, we want to help them. We are really concerned, and government is going all out. The municipal corporation is going all out. Doctors are going all out to help them. So for their benefit, what was done, that people who came from abroad and landed on our international airport, and all of them were, those who were young, were given a stamp on their hand saying that quarantined at home. But those people who are elderly, particularly 60, 65 plus, 70, 75-year-old people, who are actually at a higher risk of contracting this coronavirus illness, and if they have somehow contracted this illness and they have carried the virus from abroad, once they go back to their family, they will give it to their family members and it will spread. So they were told that they will be quarantined in a nearby hospital. This time, because Seven Hills Hospital is nearby, they were quarantined over there. Now communication sometimes goes wrong, and many of them understood that they will be quarantined for 4 hours. So they thought that from airport, they will go to the hospital, they will have to stay there for 4 hours. The nasal swab or the pharyngeal swab will be taken, and within 4 hours the report will come, and if it's a negative, they will be sent home for the home quarantine. But that doesn't happen. We know that how much overloaded we are and how much is the backlog, because there are limited number of kits for testing, and the load is too much. Large number of people are coming. So that 4 hours did not work, and they said, sorry, 4 hours did not work. You have to stay here for 24 hours. After 24 hours, some guidelines, ICMR guidelines came up and said that no, 2 consecutive swab at the interval of 5 days should be negative, and then only they can be released. So what was 4 days and 24 hours became 5 days and 7 days, that you will have to stay here. And they have a wonderful facilities, like there are different wards, and in each ward there are 30 patients, and they send swab on day 1, they send the swab on day 5, and if both the swabs are negative, they are discharged. Now in one particular ward, what happened was that out of 30 patients, 1 patient's swab came positive. So now other 29 are exposed to that patient, because all of them stayed in the same room. And because of that, they had to be quarantined for a little longer period of time. So instead of 4 hours and 24 hours and 5 days and 7 days, now they were quarantined for 12 days. So obviously they were very cooperative, they were nice, but at the same time they were very, very upset. And some of them developed psychological symptoms like insomnia and severe fear, and that they will now also develop this illness because now they are exposed and those kind of things. Now luckily the second swab of all those 29 came negative, and after third and fourth swab, now they are discharged. But they were really upset. And second problem, some of them were not from Bombay, some of them were from other cities. So for them, there was another problem, that even if they are not quarantined and they were given discharge from the hospital, where they would go, how they can go to Bangalore or Trivandrum or other cities where they are really originally from. And I think some arrangements have been made for their stay in hotels, nearby hotels and guest house, and they are being taken care of. So I think we are all on the same situations. We are all in the same boat, and variety of things. And obviously, when you have to stay in one place for in a ward, and when there is only one toilet block, the hygiene of the toilet is not good. The food is the same which you get every day. You don't get non-veg food, etc., etc. And those kind of things happen. Number of problems like people for taxi walas, etc., daily wage earners, they find it difficult how to do it, and things are becoming difficult for them. But I think overall we have kind of managed this situation very well, and hope that things will be relaxed now, and will be in a better situation, better position soon. So please, all of you, take care. This is what I wanted to share. Number 1, have lots of patience, and sleep well. Sleep is very, very important. It improves our immunity. And since now we are not working, 8 hours of sleep at night continuously, and 2 hours in the afternoon, because we are not doing anything in the afternoon. If you are not listening to things, you should have been sleeping 2 to 4 in the afternoon, and 11 to 7 in the night. So 8 hours in the night and 2 hours of sleep I recommend for everyone. It will improve your immune system and your resistance, and you will be at less likely to contract this illness. Relaxation, I have already mentioned. Extracurricular activities, exercise, entertainment, watch TV, mobile, play games with your family members. physical and cognitive exercises like solving puzzles, etc., will stimulate your brain. So I think if we indulge in all these things, we'll all be happy, and our anxiety will be less, and we'll be able to cope with this difficult situation together. Thank you very much.
Thank you, sir, for a wonderful presentation and telling us about all the situations which you have faced. And it is very nicely been explained that what situations you have gone through and what the patients have also gone through in this whole scenario. Now, I would like to ask you certain questions which are there from the audience and also which have been made by us. You have already dealt with the situation of the psychological issues which are there during this era of pandemic, and also what have you encountered. Now, sir, we also get a lot of patients phone calls, and since they are sitting at home, and we are also going to our duties. For example, today is my OPD, antenatal care OPD, and I got a phone call yesterday. Doctor, હું અહીંયા રહું છું અને મને તમોએ બતવાનું છે. Means I want to show you and come. I said, what is the emergency? So she was very anxious about coming to me and show her. So what do you recommend, sir, for routine antenatal care examination? Would you recommend that they should come and risk their lives, or they should wait and watch for only the sign and symptoms if they have something to come to us?
Okay.
How would you like to go about the counsel, and how would you advise us obstetricians in such situations where to tackle such situations about anxiety? And I want to come and show you, doctor.
Yeah. See, all of us are different, and our anxiety level is also different. So, for example, between me and my wife, I am little more anxious than my wife. So, if the flight is going to take off at 4 o'clock, I have to be at the airport, sitting at the gate at 2 o'clock. I have to be there at 2 hours before, otherwise I get anxiety. I stay very near Bombay Central Station, which is just hop, step and jump, and even if I go walking, I'll reach there in 15 minutes. If my train is at 5 o'clock, I have to be on station at 4 o'clock, 1 hour before. And people say, why are you 1 hour going there, 1 hour before and sitting there? But I'm anxious by nature. And same thing happens when invite, some invite comes, somebody's wedding ceremony or something, reception or birthday party, and it's written 5 to 8 in the evening. I read 5, my wife reads 8. So at 4 o'clock, I'm all ready and I pressure everybody, let's go, we have to be there by 5 o'clock. And she says, oh, till 8 o'clock we can go, there is no hurry. So I think all of us are different. So obviously, you have to take that into consideration and tell the patient, say, yes, I understand that antenatal examination is due. If it's not an emergency, I can give you counseling on the phone and say, okay, if this antenatal examination is not done, nothing to worry. You continue these medicines, iron, folic acid, otherwise what you have recommended. And if you have certain symptoms which you would like to know, that if you have a bleeding per vagina or if you have pain in abdomen, yes, definitely you can come. In spite of that, if the patient says, no, just for my sake, please see me. And if they have a vehicle and it is possible for them to come with due precautions, I won't mind if they come to you. At least by seeing you, their anxiety will be much less. And obviously, all the precautions you take, ask them to wear mask, ask them to wash their hands and whatever general precautions, and see them.
Excellent. The way you have answered, sir, the same way I answered her, and I told her, what is the anxiety to come? Because we are right now, today being Saturday, I had predicted last Saturday that there will be approximately 3,000 patients being positive, and literally it has come as a fact and reality that today we are standing at a peak, and this is the 11th day of lockdown, as Modi ji has advised us to stay at home and not to just get feared about or be anxious. So I told her the same thing, sir, the way you explained very beautifully, that you just stay at home, you don't have any bleeding PV, you don't have any pain in the abdomen, you're just 7 months amenorrhea, you already taken tetanus toxide. Doctor, હું આવું તમારે પાસે injection TT માં લેવાના? I said, no, you don't have to come. We will do it next Saturday or after 1 month. It's okay. You don't have to worry. And that's how we have to be very nice to them. And this is regarding antenatal care treatment and also the follow-up which they come. But regarding ultrasound, because they are at such a situation like a patient comes for a first trimester, she has completed 12 weeks, and then we have to do a second trimester. And then what do you suggest also to our colleagues? Would you recommend and go ahead and do an ultrasound, or just wait, or accordingly? Obviously, we will go ahead if it is required on emergency basis. Your take on that?
One thing, what you did was very good. And one important thing which we, when we say do's, we also remember don'ts, that what should not be doing. So even if the patient says, no, I am very much worried, you acknowledge that yes, your concern is absolutely correct. Don't say कि पागल हो गया है क्या, mad हो गया है क्या, कुछ समझता नहीं है क्या. So never ever kind of demean the patient. Always what you did was right. Acknowledge his concern, acknowledge his anxiety. Said you are absolutely right, you are concerned, you are worried. I also kind of understand what you are going through. But at the same time, don't worry, it is not necessary. And same thing can be prescribed for 2D echo, the sonography examination, ultrasound which has to be done. Yes, if there are certain indications which requires, you say, yes, it's an emergency, please come down and we will do the ultrasound. We don't want to take any risk. Though there are 3,000 patients, the population is 130 crore. So 3,000 patients in a population of 130 crores. And as the experts are telling us, 30% will not have any symptoms, and another 55% will have a mild symptoms, if at all, even if we contract this illness. So 30 plus 55, 85% of the people, even if they contract this illness, will not have any problem. It will be like any cough, cold, fever remaining for 2 days. In my last 50 years, I must have had at least 10 episodes in which I had a dry cough for 2-3 days, then fever for 2-3 days, body ache, fatigue, malaise. I slept for 2-3 days and I bounced back. So all of us, you say 85%, even if they develop problem, will not have any problem. Yes, for 15%, they may require admission in the hospital and proper care. Some of them will require intensive care unit, particularly elderly people who are immunocompromised, those who have multiple other illness like diabetes, hypertension, chronic renal disease, etc., bedridden patients, and some of them, maybe 0.01% or 0.2% may die out of the whole population. So I think very reasonable, healthy attitude towards this COVID-19 is necessary.
Yes, sir. Sir, there is also a situation where they are undergoing vaccination schedule. One patient is online and the vaccination schedule has to be done. Means the tetanus toxide is there. There is also hepatitis B injections. In lockdown situation, we would like to have a such situations, because she is anxious, she is worried about that.
Yeah, see, I have two suggestions. One, as you rightly said, that if it is not absolutely necessary and it can be postponed by a week or so, it's absolutely fine. But if you think it is essential, and it is essential for most of the people to receive that vaccination in time, then, it is an essential service. I receive my milk every day. I receive our dhobi, who comes, takes away our clothes, washes it and gives it back every day. It is considered as essential service. And going out and buying a packet of biscuits or whatever food items we require. Similarly, certain nurses can go to those people's house with due precautions and give the vaccination at home. It can be easily done. The way other services like milkman goes to everybody's house, similarly certain nurses can go to these people's house and give the vaccination. So if it's possible, we can provide that. And as you rightly said, if it's not absolutely, we can wait for another week or two, and it's not absolutely essential, we can wait. The fear is that we are saying at present that lockdown is going to be only up to 14th of April. But that is our assumption. Previously, it was 30th, 31st of March. It was extended to 14th April. What is the fear is that it may be extended to 30th of April, and then it may extend into May and June and July, because some researchers from Cambridge or Oxford have said that 49 days of 49 days of quarantine may be required. So I think that they are working on it. Our government has many wise people, intellectuals, doctors, administrators, and they will kind of find a good way of relaxing this kind of total close down for few hours, or they will make some arrangement so that people do not suffer.
Sir, actually what has happened is people have got bored now. Today is 11th day.
Yes.
I will come to the obstetrician's point of view also later on. But, being there as a pregnant lady at home, cooking meals, and then washing utensils. Husbands are being very nice nowadays, and they are really helping, supposedly, their better halves, especially being in pregnancy, to adjust with their mood changes. And obviously, we are, they are doing their best to get all these situations under control. Obviously, there are clothes to be washed, etc. And now the TV boom has come. Now the TV is directly in your mobile. You just have 2 GB internet connection to you, and obviously you don't have to on those TV channels. I want to see this TV channel, I just put it on, and I can just go on and on and on. So what has happened, apart from the household chores and the daily activity which people are doing, our pregnant women are doing and their families are doing, there is something which has cropped up about mobile addiction. So I would like you to say and advise to our patients, and also give tips to our obstetricians on this issue.
Okay. Addiction is something which is very widespread. And earlier we talked about addictions to alcohol, addictions to drugs. But nowadays we talk about behavioral addiction. And in behavioral addictions, this is one of the common thing, mobile addiction, internet addiction. And in internet, again, gaming addiction or addiction to pornography, watching pornographic films. Apart from this, even in this shopping addiction. And now you don't have to go out to shop. You can just shop online. And there are many sites, Amazon and other things, where you just you get this advertisement and you go on shopping and COD, so cash on delivery, so you don't have to even pay, and automatically these kind of things keep on coming. My take on it is that it's a person who gets addicted. It's not the mobile, it's not the alcohol, but it's a person. So see, there are large number of people who take alcohol once in a while in a socially acceptable manner. And in our meetings, in our conferences, during banquet, we see large number of people take alcohol, doctors take alcohol, and majority of them, say 90-95%, take in a socially acceptable manner, once in a while, little quantity, just for kind of little feeling good, etc. Relaxation, etc. But there are one or two people who cannot control and who go on drinking alcohol to the extent they are suffering from an illness called alcohol use disorder. And if they are suffering from that illness, they will not be able to control their alcohol use, and they will get drunk, and at the end of the conference and the end of the banquet, when everybody has gone, they will be lying there and then one or two friends, colleagues, and people from pharma company will have to take help and say Ganpati Bappa Moria, pick them up and take them to their room. So it's an individual who develops addiction. So same thing, I can use mobile in a socially acceptable manner and can make a good use of mobile, or I can get addicted to it and I keep on using it till I get addicted, and then the bad effects means my sleep gets affected, my sleep wake cycle gets disturbed, and variety of problems. I stop going to school, I stop going to my work, and I'm preoccupied, and I wake up with mobile, I sleep with mobile. So that mobile addiction, and that is very, very true. So it's
how
an
much
individual. Yeah.
how much you recommend that so much hours of has to be done, or not more than that? I mean, there are any guidelines
Yeah.
from Psychiatry Association,
Yeah.
and apart
Yeah.
from
So recreational use should not be more than 2 hours per day.
okay,
Now, suppose you have some urgent call from the patient, or you are guiding somebody on the phone, or you are attending some meeting like what we are doing now, or there are certain mails which you have to inform, and from hospital we get emails, etc., that we have to check and respond.
WhatsApp.
Yeah, WhatsApp. So curricular activities, we have to do it the way we do the work, we have to do this. But recreational use, where actually it can be avoided, means it's a recreational use, should not be more than 2 hours in 24 hours. So if you are using more than 2 hours, then you are at a higher risk of developing addiction to it. There are some other criteria like, if the first thing in the morning you take the mobile, or if the mobile is not there, you become a little uneasy and you cannot stay without mobile. So then also it means that you are kind of addicted to it. So one has to be very, very careful and make good use of media, social media, mobile, TV. But at the same time, as you rightly put it, don't get addicted to it.
Yes, sir. Sir, which psychiatric illness aggravates in pregnancy, especially during the lockdown period? Very difficult. I mean, obviously, we are facing all this first time in our lives, and there is no research on it. But a very interesting question has come. What do you feel in last 11 days? What things could have got aggravated in pregnancy?
Okay. I think now one thing, that family is together.
Yes,
And
sir.
we are
Sir, I'm
not-
coming to that.
Yeah.
I'm coming to that.
So we are not used to that. But if you are asking per se, biologically speaking, whenever there is a low serotonin in the brain, you tend to develop depression, you tend to develop anxiety, and estrogen and serotonin go hand in hand.
Okay, sir.
So whenever there is a fall in estrogen, so in women, the fall in estrogen occurs during premenstrual period. So premenstrual period, just few days before the menstrual cycle starts, there is a fall in estrogen, and along with that there is a fall in serotonin. So we get premenstrual syndrome. People get little irritated, little angry. You may not recognize your wife at that time. You say, what has happened to her? And she becomes little snappy and
Sir,
back
how you
answers.
can say that you don't recognize your wife?
Means you feel she has changed. Like,
oh, she has changed. Okay.
changed. Yeah, her mood has changed.
Personality has changed.
Yeah. So that way, mood-wise, you feel, oh, she's a different person. So
Yeah, if she
premenstrual
would have
syndrome.
changed, I would have appreciated that. But
Yeah.
personality too specifically.
Personality. Komal is listening over there.
Yeah, yeah.
Second, during the postpartum period, again, sudden withdrawal of estrogen, and along with that, there is a fall in serotonin, and people are at a higher risk of developing depression, what we call postpartum blues or postpartum depression, and sometimes severe depression, they go into postpartum psychosis. And again,
God.
during menopause, the estrogen level falls, and they are at a higher risk of developing depression.
So this lockdown is like a solitary confinement to some people. Once in 4 days, you may go, and you being, a patient being pregnant is not allowed to go out, and she's just confined to the room. She's just confined to the house. Maybe the house is 2 room kitchen, or maybe 3 room or 1 room. But unfortunately, the situation is there, and as you said, all these issues can come. So interestingly, now we come to a situation where one fine day we all will be free birds and roaming out on, the freedom will be there, and hope soon that the day comes as early as possible and we can really meet in reality and in person. But what do you feel, that will there be an increase in marital conflicts which you will see after that lockdown period?
Uh, I am an optimist. So I feel that for most of the people, staying together at home will help them to understand each other better, spend time with each other, family time. And most of the people, instead of fighting with each other, getting irritated with each other, will kind of say, okay, let's be together, let's play together, let's cook together, let's clean together, and be tolerant to each other's personality. And I feel that people will use this time to rejuvenate their relationship rather than
Absolutely.
spoiling their relationship.
What a wonderful statement you have given, and I'm sure their relations will be improving, and especially the husbands and the relatives will be taking utmost care for our pregnant patients, and it will be very nicely tackled. And you have already given a very apt advice that, as an obstetrician, you have to be very kind to them and be nice to them, not to get agitated as such. We are also sitting down at our place. We have only certain amount of time where we are, being seeing patients. Like in one day, if we are seeing nowadays 80 to 100 patients or 200 patients a day in our antenatal period, we are just getting probably a few calls. Now, there is also one thing about video calls, which the patients are coming and they are giving. And would you feel that seeing a doctor, it's on the screen, and seeing in person, that helps them a lot, or just an
Yes.
audio call would help them?
Uh, I think video call is better. We see each other in person. Just imagine if this conference, which we are doing, a webinar, if it would have been an audio webinar, how would you feel? You will not be able to see me, my expression, and I won't be able to see you. And number of people, as you said, 1,000 plus people are watching us live.
Oh my God. Yeah. Thank you.
So I think video call is a wonderful thing. Nowadays, WhatsApp calls are almost free. You have many other apps where you can party, and like Zoom and Skype and many other things where people can see each other, talk to each other, socialize with each other, play games with each other. So I think this is wonderful, and if possible, we should encourage video calls with the patients.
Okay. Now, once this patient has already travels from the antenatal period, first trimester, second trimester, I hope they are in the third trimester. Then we have nicely tackled, and sir, you have wonderfully told us how to go about talking to them, improving their anxiety, relieving their stress, helping to see that the family is involved in this unfortunate period, and then she goes in labor, and there is no ambulance, there is not a single taxi on the road, and there are only policemen around. Unfortunately, it's a daytime, and such situation comes, and she calls you. How would we go about it? Psychologically, obviously, we will help her and hope she gets. But now we are worried that she could be a COVID patient, right? It could be in her community, it could be there with herself, or, obviously, we are going to take the guidelines and the precautions when she enters there, and we would go about and see that she delivers and undergo a cesarean section, or whichever the situation is there. And that's what we are here. So we are going to reduce her anxiety. And would you advise some thing that we as a obstetrician should maintain about her mood changes and also about her contacts tracing, because that's what we are hearing nowadays, because my residents are on front lines right now. I am just being there on the second line, but front lines we don't want to be directly exposed to them. So we will come to that question also from doctor's point of view, but for the patient, we are more worried. So would you advise to take some consent which we take from the patient, and will that affect her psychology, and how to go about it?
Yeah. Uh, Niranjan, I am a movie buff.
Okay.
So I am reminded of this movie called Three Idiots. And in that, there is a scene that sister, Kareena Kapoor's sister, goes in labor. And at that time, it's raining heavily and nothing is available. And then they connect with each other on video, and it's lots of exaggeration, and they make a suction pump out of some
Motor.
and then they deliver that child. Now this is a movie, and I think earlier and even now in some of the remote villages, they don't go to hospital for delivery. There is a home delivery, and there are some people who are proposing that the delivery should be at home only. So I am not recommending home delivery now, but suppose there is a situation
Yeah.
where
Suppose we are not in metro, we are in rural
rural
state.
areas,
There is peripheral,
so
primary health center.
so they will have no other option but to conduct the delivery at home or at primary health center, or
So
there
video
have they,
call,
yeah, no video
probably
call also, yeah, so audio call, probably on
audio
audio
or a
call,
lockdown call.
lockdown call, you will have
Okay.
to guide them. And I
Right.
know that people have conducted deliveries in buses, taxis, trains.
Ah.
Recently in air, somebody delivered in aeroplane, and no doctors were available, and somehow they managed to do it. So I'm very, very sure. And rumor was that the baby who delivered in the plane, that airlines have given her free pass for the lifetime, that she can travel by that airlines anywhere in the world throughout her life. Now I don't know really it is true or
No,
not.
sir, it is true.
It is true. Yeah. So I wish I would have been born in an airplane. I would have got a pass and traveled all over the world free of charge. But jokes apart, uh, I think it is possible to conduct the deliveries at home, and in difficult situations, if people will have to do this. Otherwise, as I said, that if there are certain nurses who have trained into conducting deliveries, if the patient can't reach to the hospital, the nurse or the doctor should reach their home and conduct the delivery, or help the family members to conduct the delivery. The second question, if that patient is COVID positive, irrespective of that, whether COVID positive, HIV positive, cancer, some other illness, irrespective of that, we have to help them. We cannot say that she is COVID positive, so I will not conduct the delivery, or I will not help her. Whatever illness she has, even if she has an illness which can be contracted, we have to take all due precautions. As they say, PPE, wear PPE, personal protective equipments, conduct the delivery. And as I said, risk is not very, very high. Even if you contract the illness, 85% of the chance it will be mild. If at all, if it's there, you might develop little cold and flu for a few days, and you will be fine. So I think as a doctor, it is our duty to help them in whatever best possible manner we can help them, irrespective of whether they are at home, whether they are in primary health center, whether they are in our hospital, whether they are HIV positive, HBsAg, HB hepatitis positive, or COVID positive.
Absolutely. So nicely you have gone through it. There's one more question, that if this patient is COVID positive, and fortunately we are knowing about it, there's one question which has come up about breastfeeding. I know this is not your domain, obviously, since the antibodies will be passed on to the mother. What would you advise? I mean, what would you advise us? So, should we go ahead with that, or they should be advised with some any other form of milk?
Yeah. So there are two ways of looking at it. There are one group of people who feel that children should not be deprived of breastfeeding. Breastfeeding is very, very important, and after taking all due precautions, so mother should wear gloves and mask and maybe other precautions, wash her hands, etc., etc., and should continue breastfeeding. So that's one way of looking at it, because then breastfeeding is very, very important for the child should get milk, and that milk is very rich and it has immunoglobulins and other things. Plus, the contact between the mother and the child is important. The other way of looking at it is that if the COVID is not a lifetime illness, if the person is going to be sick for only 4 or 5 days and after that she is going to be fine, or at the most 15 days, and if first swab is positive, within 15 days she is going to be negative, then why take a risk of giving it to the child and wait for 15 days? Keep on milk, take out the milk so that you don't stop lactating. And after 15 days, when you are negative, again start feeding the child. So I see both the things, and one kind of situation may be good for one group of people, other kind of situation may be, and I would talk to the mother and what she would prefer. So I would go by by her preference.
Absolutely. So wonderfully you have answered about the psychological aspects. Now we have covered most of the topics regarding the patient's anxiety, the depression which we have gone, and the patient's allaying the fear and how to go about, how she should manage about it, what advice psychologist or a psychiatrist which can be given by an obstetrician to the patient, how to deal with them with video or audio, and even to an extent that you may also help her to deliver to certain extent by all this telecommunication facilities which are there. And obviously, sir, our guidelines also are saying that once following delivery, breastfeeding has to be done, can be given. It's not an issue that there is any problem with that. Now, what has happened is we are coming to the doctors now, that is obstetrician. We are also in the same situation as any patient is there, but we are not pregnant. That is very important, and we are also having our own fears. And there is a certain panic situation amongst us. Sitting at home, we are also watching those numbers, not only the national but international numbers going skyrocketing, and it's just not coming down. And as a result, there is a panic situation amongst obstetricians also, to certain extent that we used to just wash our hands 4 times a day before eating food or when we went to our washroom. But now it has happened like an obsessive compulsive disorder. And if even if you touch a surface, or even if you touch a car key, or even if you touch any paper which comes on your desk, or even if you go and touch a patient and take her blood pressure, or even if you are you are little worried about that. And obviously we are the frontline health workers. The morbidity and the mortality rate is 10 to 12% to us because of the high viral load, as compared to a normal person who is walking on the road or staying at home. It is only 1 to 2%. So that is something about obsessive compulsive disorder. Would you just talk about that? I mean, obviously there are guidelines which have been given that you have to wash your hands for 20 seconds and fine. But there are certain things about this COVID fear which is always there.
Yeah.
So your tip to our obstetricians who are listening, and I see now more than 2,000 people have joined our video live webinar.
Yeah, see, if you have a short-term obsessive compulsive disorder lasting till the COVID fear is over, lockdown is over, and now we are more relaxed, it's absolutely fine.
So it is not an illness. So it is not an illness for all.
Not at all. It allays your anxiety. Okay, I have washed my hand and it's okay. Good, chalo, I have washed my hand. So as long as it is helpful, And instead of 4, if you are washing your hands 14 times in a day, I don't mind. It's an extra precaution, and it will help you. It will not only physically help you by remaining clean, but mentally also you will be at peace that yes, I washed my hand. And it is going to be only till now. And once this COVID fear in another month or two is over, then again you will be back to your 4 times a day washing your hands.
Sir,
So
is it long-term effect which we will see, or we will improve our hygiene? India will improve the hygiene
yeah, no. We don't
practices.
change. We
We
are
don't
all
change.
same. No, personality
Okay.
remains the same throughout your life.
Okay. So I think you have answered that wonderfully about the doctors allaying fear. Now, what happened yesterday, if I would like to share with all of you, I just came, I sat in my room at Science Hospital, and then while talking, I just had a conversation with our dean sir, and immediately my registrar called me. Sir, there is one patient who has come positive, a COVID positive patient who has just we operated a day before yesterday, and there is some confusion. We got a call from Kasturba Hospital, and there are the name of the patient. I would like to just give an example is Sapna. And sir, there are 3 Sapnas in different units, and we are just having a panic situation now amongst us, how to go about it and deal. And ultimately, it took us 2 hours to find that patient, and then we came to know that that Sapna patient is not Sapna patient from Sion Hospital, but she is from some another hospital, and that reduced the anxiety and the fear amongst the residents. So this was a very different situation where, and everyone goes in the panic state because it immediately goes to MSS unit, RVM unit, AHN unit, and other units, and then अरे तेरे unit में patient है क्या? अरे तेरे unit में patient है क्या? So I'm just taking about this, and we are really anxious. Second thing I found out that now my residents who are at front line, we have been advised about hydroxychloroquine, right? HCQ, which we have to take, chloroquine. Now, obviously, they are at front line, and they are at a situation where they are dealing with patients directly. Still, we are getting routine patients about 80 to 100 a day to come, and there is a fear that I might get, and we are doing social distancing, everything. Now, how to allay this fear?
Yeah. So, as I said, that if the fear is not interfering with day-to-day functioning, that means that in spite of having that fear, in spite of having that anxiety, concern, worries, they are sleeping well, they are getting up in the morning, they are taking care of themselves, they are taking bath, they are brushing their teeth, they are coming to hospital, they are doing their work, they are watching movies, they are enjoying with their friends, etc. I would leave it alone. But if they have a symptoms like insomnia, palpitation, tremulousness, not able to concentrate at their work, constantly preoccupied with these ideas of having COVID, or for themselves or their relatives, that my mother will develop or father will develop or so and
Yes,
so will develop,
yes,
etc.,
yes,
etc.
yes.
In that case, they need psychiatric treatment. So, say for example, if the menstrual
So I had
bleeding is little,
one resident had a panic attack in the ward
yes,
itself, in the labor ward. I mean, it was
yes.
such a
So,
tense situation. 4 hours of us had gone to manage that situation. And yes, please continue, sir.
yeah. So, if you are symptomatic, then you need treatment. So, as I'll give you an example, I was giving example that menstrual bleeding, if it's normal, 4 days, some amount of blood loss, and you say it's normal, not to worry. But if it is too less or too much, then it requires treatment. Similarly, if anxiety is too much, and particularly it is interfering with your day-to-day functioning, then of course it requires treatment. Any of these residents who are getting repeated panic attacks, severe anxiety, not able to focus, you can send them to us. We will treat them, and mild anxiety, we treat them with counseling. If it's moderate to severe anxiety, we give them medicines, and these medicines improve their ability to cope with this anxiety situation. It improves their sleep, it improves their mental ability to cope with a stressful situation, and they will be much better. So
Okay,
both
okay. Sir, one
counseling
question
and
has come.
medicines.
Sir, there are 4 or 5 questions lined up, but we'll go one by one. Is there any psychiatric association helpline where the doctors can call or the patients can call? Obviously, which is very important. Like we had about 2.5 weeks medicine consultants from Mumbai. They all came together. They formed the duty timings from 9 to 12, then 1 to 4, then 7 onwards till 10 o'clock, and 4 of them were involved. So I would appreciate if Psychiatry Association also comes
Yes.
in forward in hand with the government. And is there any helpline?
Yes, yes. Number of psychiatrists, not only from Bombay, but from Thana, Pune, Nagpur, Aurangabad. Number of psychiatrists have kind of formed this kind of groups and send this details of their
Amazing,
names
amazing. Okay.
with phone numbers and the timings, that if you have anything, please feel free to contact. And they have also started doing counseling on phone, and they are helping the patients. So number of psychiatrists have started this initiative.
Okay. Sir, there is one incident which has happened in Telangana, and especially in a light of a case where a man broke the quarantine and killed an elderly woman.
Yes.
What do you think could have happened to this guy? Obviously, we don't have the history from psychiatry point of view.
Yeah, see, we call it
Can
acute
we
psychotic
identify
episode.
such patients who are quarantined or locked down?
Yeah, see,
Especially when a woman who has been quarantined now for 14 days or 21 days and now she comes to us to deliver, or her relative.
yeah, see, we call it acute psychotic episode. Acute psychotic episode, anyone can develop. And unfortunately, we do not know. In the past also, he had history of schizophrenia or some psychotic disorder, but it looks like that this is the first time in his life he developed this acute psychotic episode, probably precipitated by sensory deprivation. He was all alone, or some other factors may be there, and then he ran out. Now, these kind of instances occur even day in and out without COVID illness. Means when there was no COVID, when there was no lockdown, there are large number of people running on the road. According to one estimate, there are 1 lakh road-sided patients in the city of Mumbai who have schizophrenia, and they are on the road and nobody is to look after them. They are roaming on the road, and many times they are shouting, screaming, they are not well, they are half nude, they are gathering food from the dustbin, drinking water from the puddles. And Dr. Watwani is rehabilitating these patients, and he got Magsaysay award for the same. So this has become a highlight in a way because of this COVID, but this kind of instances even otherwise have been occurring. So it's not something new, or I'm not surprised that something like this has happened.
Okay. I request Dr. Komal Chavan to unmute her audio, and I request her to add some questions if she has for sir.
Yes, sir. So excellent way of communication, and it was very nice hearing all the experience and everything. So there are some questions which have even come from the audience. There is one question from a mother who wants to know, like, what is the psychology? There is in this COVID-19 era, and they already have one more small child, and they feel that the child's immunity is very low. So probably the mother feels very scared. Ki the child's immunity is low. So will I, because of me, the child will get some infection, and so probably she's trying to stay away from or distancing herself from that child. So how to deal all that issues also?
Yes. So probably that mother has an anxious personality. She is little over anxious by nature, and her concern is in a way genuine, and in the sense that people have been telling that you can give this illness by close contact. And obviously children are going to be in close contact with that mother. I would like to find out little more about that mother, whether she is still at home only, or whether she is going out, she is working, she is a health professional. Because in that case, her anxiety is reality based. Like say,
Yeah.
for example, I'm going out and working in the hospital and meeting people, and particularly if I'm posted in a hospital like Seven Hills Hospital, where specifically people are quarantined, or if I'm
Yes,
working in
go
a
ahead.
Kasturba Hospital, where
I
I'm
want
at
a
a
charger
higher
here
risk of
urgently.
contracting or getting this virus home, then obviously her anxiety is genuine, and we will kind of help her to deal with it. That take certain precautions, like when you come home, don't immediately go and pick up your child. First, you go to the bathroom, change your clothes, take bath, dispose of those clothes in a proper manner, wash them properly, and then after taking certain precautions, you can go and be spend time with your child. So obviously, I think I will like to know a little bit more about her daily routine, and based on that, I would like to counsel her.
Yeah,
And
because
if it is exaggerated, she may require some medicines
yes,
to calm her down.
because how much she is doing, she may feel that is less. Am I doing things right? That is actually the feeling phobia which everybody has. Everybody is clearing food. The packets which we get from outside. Everything. See, people are getting their daily essentials, but they don't. But they can come with infection. So
Hmm.
that obsession of cleaning, about see, in a way it's a right thing to get everything clean, but probably it becomes too much. So, sir, how to tackle that? Like about the cleaning and obsession.
Yeah, so if she is not able to control it by counseling, then medicines are there, and we can give certain medicines to allay her anxiety. And once her anxiety is taken care of, her behavior will automatically change.
Sir, you mentioned about the Psychiatric Association helpline. So, can the viewers or the who are listening to us, can we have the benefit, or you can share us, or where we can find those numbers on Google?
I have received it on my WhatsApp groups, and what I can do, I can send it to you, and then probably by some means we can
Pass it
send it
on.
to everyone. Another thing, most of the people, like say for example, uh, your patients. Now you know certain psychiatrists, like you know me, so you can pass on my number, and similarly you know few other psychiatrists. You can talk to them, and if they consent, then you can give their numbers to your patients and request them to call us. And obviously, I will also pass on the numbers which I have.
Yeah.
The number of doctors from Bombay have started this initiative, and I'll be happy to pass on their phone numbers, timings, etc. when they are available.
Sir, one more issue regarding this pregnant women. We know that when a patient comes to our OPD, they're in a normal pregnancy, and most of them are first time, and many are working patients. So when they come to our OPD, we spend time, we do counsel them because everything is new to them.
Mm-hmm.
But in this era of this COVID infection, where they are doing a audio consultation or a video consultation, and when they are newly pregnant, or probably they have just got a UPT positive, or maybe there are some patients who have just visited once to a doctor and was asked to follow up. So in this patient, what additional points we gynecologists should keep in mind while addressing and while counseling such patients?
Okay. Uh, See, many times what happens that it's a uncertainty. Now you are first time pregnant and you have never observed delivery. What is happening during that time? So it's only in your mind, and you have heard from other people that it's very painful, or you have to make so much force, or some people slap you at that time, and many things are hearsay, and many of them have myths related to pregnancy and delivery particularly. So I think that educational videos where they are actually shown, or if it's possible, I'm not sure whether it's possible, but actual showing them that this is the normal delivery looks like, that the woman gets this contractions and gradually the child comes out. Even if you show an animation film, I think it would be great relief that exactly what is happening will be clear. And instead of having an imagination that what happens during delivery, what happens during pregnancy, if they have actually seen a delivery, then that might allay their anxiety, and the questions related to that, okay, what happens like this and why like this, we can answer them and allay their anxiety.
Okay, what about the superstition? Patients have a lot of superstition related to this COVID infection. So how to tackle with those beliefs?
There are two types of superstition. One are benign superstitions. Like, say in my house, people say don't go for a haircut on Saturday. Now I don't go on Saturday. What difference does it make? I'll go for a haircut on Monday. So if there are minor superstitions and they are not affecting our day-to-day life, it's not something, then forget about it. It's a religious based, it is cultural based, and we cannot fight them. But if there are superstitions which are harmful to the patient,
Yes.
in that case we have to be very firm and by anyhow prevent the harm to the patient. So if the mother has a demand, mother-in-law or a mother has a demand that the delivery has to be on such and such day, and if it's not in the good interest of the patient and they bring you and you say, no, deliver on such and such day at such and such time, because we have a superstition saying that if the child is born in this time on this day, then only he will become a good child or something like that. We defy that and we say, no, we are not going to do that, and it is not in the good interest of the patient, so we will not do it. So there we have to remain firm and see that patient is not harmed. And in that case, even if we have to take a legal help or police help, we should take it.
Also, in the many incidences what we see on television, because of this COVID fear, there are some people in remote villages, they are keeping something in front of their houses or something. So those are totally superstitious. And so how, like for benefit of those, like how they can break those beliefs? There is no way we can go and talk to them personally, but if there are somebody doing in front of you and you have to tell them, so how is the way of communicating with such people?
So as I said, if it is not harmful, I will say, okay, keep it, no harm. If they want to come some piece of limbu mirchi in front of their house, and if by that is allaying their anxiety, by keeping limbu and mirchi in front of my house, I will not get COVID, I'll be protected from COVID, I'll say do it, no harm. Because keeping limbu mirchi, what difference does it make? How it is going to harm anyone? But at the same time, it allays his anxiety.
Yes.
So let him do it.
But it becomes a herd mentality. If somebody is doing it and getting, so everybody will start doing around,
So everybody puts limbu mirchi in front of their house. It is not a harmful thing at all. You try and explain, but I don't think people will listen. We have two instances in Bombay itself. One was Lord Ganesh is drinking milk.
Yeah.
And thousands of devotees, in spite of giving scientific explanation of capillary mechanism because of which you feel that Ganpati is drinking milk, and actually Ganpati Ganeshji is not drinking milk, and why he should drink milk. Yes. And what is this thing? People still believe that no, not only it's villagers or illiterate people, even literate people wanted to believe. Similarly, the water near Bandra sea has become sweet on certain day because of some religious thing, and people started drinking water and they say, instead of khara pani, samudra ka pani meetha ho gaya. And actually there was a scientific explanation that during certain things the salinity of the water decreases, and that's why it can taste sweet rather than salty. Now you explain to the people who want to know it. But if the people don't want to know it, let them believe that there was some miracle. How it is going to harm us? No problem.
Okay. Thank you, sir. Yeah. Sir, one more thing is that we know now the COVID in pregnancy is not very much in India right now, but we have other nations, other countries where the infection is in a total full-blown stage. So are there any studies from there showing what is the rate of depression or any psychological aspects in affecting the pregnant patients? Have you have any data from those countries about the psychological aspects and pregnancy?
No, I am sorry, I don't have any such data. I am not aware of any such studies where they have specifically studied depression in pregnant women in COVID positive patients. There must be somebody who must have done this kind of data, but I am not aware of it. But depression is very, very common. 1 in 5 women will develop depression at least once in their lifetime. So it is not unusual. Second, viral infection increases the risk of depression. So we see patients after having some febrile illness presenting with depression. We have seen patients after developing malaria and recovering from malaria presenting with symptoms of depression. So of course, any kind of infection, particularly viral infection, can increase the risk of development of depression. For that matter, even any kind of illness increases the risk of developing depression in any person, not only women, but even in men.
So there are some patients who are really very reluctant. They even if some investigations are must during pregnancy. So we have some patients who want to come to doctor again, but there are some patients who are so scared to even go out of the house, and even if something is really dire essential, they will still not go. They will say that I will get the infection, I'll get the infection. So how should we help such patients?
Yes. So now if he
Even
is
for a
not,
routine scan or something test or pregnancy, some blood test. So they will not go out for essential things.
yeah. So two things will have to be done. If it's possible, the counselor can visit their house, because they are not coming out of their house. They are not visiting a doctor. They are not coming to the hospital. The doctor can visit their house, and we make number of home visits and talk to these patients. And after proper explanation, after counseling, and sometimes after giving medications, they show improvement, and they are willing for these investigations. In some situations, psychotic disorders like patient has schizophrenia, and some investigations are absolutely necessary, and the patient is not willing for that investigation, and if it's a life threatening. So for example, patients having catatonic type of schizophrenia, who stops eating, stop doing everything, and it's a life threatening situation, we enforce treatment. So we go home, pick them up against their will, admit them in the hospital, following proper procedure, and then treat them with the consent of their relatives. So at times we have to enforce treatment in this kind of patients.
So
Okay.
by visiting, and we can even
Enforce treatment, yeah.
yes.
Yeah, Niranjan wants
Okay,
to say
sir.
something.
Yeah. Sir, wonderful discussions going on, and it's been more than 2,500 people who have joined us, and they are still enthusiastic. I'm just being run down with some 10 to 15 questions being lined up right now, but we will just take important one, and I would like to appreciate here Dr. Neena Pachapurkar. I don't know from which place, but Dr. Neena, thank you for a very important question you are asking us, and it says that should we suggest COVID test for all patients in labor? Obviously, it's the domain of an obstetrician, but what do you suggest as a psychiatrist? From our
Okay.
point of view.
Yeah.
Now today we have, because that patient can be a COVID positive after 5 days, 8 days.
Yeah. See, current guidelines, there are definite guidelines who should be tested for COVID. And in that, it is very clear that all the patients need not be, even all the pregnant women need not be tested for COVID. So it is not
Absolutely.
necessary for all the pregnant women to be tested for COVID. We should not be afraid of this. We should not have this fear, and we should not examine each and every person. That way, any person can be. I can be COVID positive, and you can be also COVID positive. We are asymptomatic person, so we need not be tested at all. Even some of the physicians have gone to the extent that even if you have fever and sore throat, you need not be tested for COVID, because it can be any viral fever, any common pharyngitis, and within 4 or 5 days with a treatment, you are going to recover. Only there are certain things, if you have traveled from abroad, and if you have high grade fever with sore throat, and if you have difficulty in breathing, and there are certain criteria, then only. So I think medical experts have already laid down criteria for testing, and it's very clear at present that there is no recommendation saying that all the women who are pregnant should be tested for COVID.
Absolutely. There are guidelines, and Dr. Komal Chavan, who is the chairperson of medical disorders, can throw a much better light, as she is one of the contributors for the GCPR guidelines regarding COVID management, which just got released few days. Thanks to Dr. Alpesh Gandhi, Dr. Atul Ganatra, and Dr. Parikshit Tang, and there are about 20 contributors, including Dr. Rishikesh Pai, who have contributed. So maybe Dr. Komal, can you just say a few words?
See, actually, the guidelines are very exhaustive. We are going to have subsequent webinars on it, and soon we will be having, and we'll discuss them more in detail. So I think we have one more interesting question coming up from our one of the gynecologists, and so many conditions like a woman having an abnormal uterine bleeding, like we keep getting them in our gynec OPD daily. Our routine OPD stand close, but there are some patients who require evaluation. Like if the patient is having a postmenopausal and if she's having a bleeding or a postcoital bleeding or some kind of a menstrual disorder with abnormal bleeding comes up, and what is underlying, what is our fear is that it may not be a malignant or it can be a gynecological cancer which is ruled out by series of tests. With all the situation around, patient may get really when such things come, and they may be normal things, but we know they are normal, but definitely there is an evaluation done where we are not able to do a complete evaluation at this time. How to counsel that patient or how to remove the fear of cancer from such patients?
Yeah. Uh, in fact, recently we had such patients where she felt that she's suffering from CA breast, and all investigations were done, mammography was done, and after 2 or 3 independent doctors told her that no, there is no evidence of CA breast, she kept on feeling that she has CA breast. Now, this is what we call illness anxiety disorder, and initially there is only anxiety, then it becomes an obsession where you are preoccupied it, then you actually believe in it where it becomes like a hypochondriasis, and then it becomes a delusion, false unshakable belief. So in spite of repeatedly telling them that no, you don't have a cancer, they believe that they have a cancer, and when you try to explain, they feel that because you don't want to reveal that she has a cancer, you show her the report, she says no, 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 you have changed the report because you don't want to reveal, because you feel that once I know I'll be depressed, so you are not. So then they develop delusion, false unshakable belief which cannot be corrected by any rhyme or reason, and it is not shared by other people in the community. Now in this kind of situation, they require a psychiatric treatment. So depending on what level, it's only anxiety, we give anti-anxiety medications. If it's a depression, we give antidepressant, and if it's a delusion, then we give antipsychotic. And in this kind of situation, if they are harmful to self, means if they are suicidal, that I have developed cancer and now I want to end my life because I don't want to suffer, even we give electroconvulsive therapy, which may help them. So any this kind of patients who have a delusion, a fixed false unshakable belief, in spite of your counseling, in spite of showing investigation reports and telling them that no, you don't have this particular illness, and if they continue to feel, and as a result their day-to-day functioning is affected, then please refer these patients to your psychiatric colleagues and they will take care of them.
Okay, thank you, sir. Dr. Niranjan Chavan has a question.
So, a very important question has been asked by one of our colleagues, Dr. Meenakshi Parihar. Could there be any medico-legal problems? Obviously, this is not to a psychiatrist, it is to us. But since we are prescribing medicines, and we have been told now, like you can go ahead and do a video call or an audio call or by a message. And if unfortunately something mishap goes wrong, so just your take on that.
Yes, I think there are number of cases, number of case reports where consulting on phone has gone wrong, and it has resulted in death of a patient, and patient's relatives have gone to the court, and depending on the situation, court has taken the cognizance, and if the court felt that it was a negligence of the duty, means the doctor should have said certain things and she should not have given and the doctor should have said immediately come to the hospital or come bring the patient in emergency, and doctor has leniently kind of ignored, and it's basically what we mean dereliction of duty directly causing damage, then yes, you are liable.
Oh my God. So you have to be very careful,
Very
and
careful, yeah.
yeah, in spite of Maharashtra Medical Council and other medical councils have said that yes, you can, in such situations, you can advise them, but in the court of law, we don't know how it could be taken.
So
But in
it's
this,
not only for the counseling, video counseling. Even in real life, if you go wrong, you have to go to the
Yeah,
court.
obviously.
gynecology.
So same thing holds true for even video counseling.
Yeah,
Yes.
but I think video counseling is now because of all the situation where everybody is working from home and there are some ailments which can be discussed over. So it is by all societies and all have discussed with our prime minister, and video counseling is now valid. Earlier there was ban on the counseling. Now they are saying it's a valid way of communication,
Yeah,
at
but it
least
is
for the
only
time being.
during lockdown period. It is
Lockdown,
not to be.
not generally.
Yeah, it's only during the message has to be going clear. So I think it's more than 3:30 now, and so you have answered wonderfully, and I think we have given justice to the audience. And obviously, there were about 50, 60 questions which we have come up and answered them. Still, there are 10, 15, but surely, if time permits, right now it's not possible. But sir, due to this heavy demand, we would and we will call you back.
Thank
I'm
you very
sure
much.
And
you will be very generous enough to spare your valuable time. Being a Saturday weekend, it's a wonderful time to hear from you, and especially you being our president of Indian Psychiatry Association and the insights which you have given. So I thank you on my behalf as a moderator, and I would now request Dr. Komal Chavan, the chairperson of the Medical Disorders Committee, to give the vote of thanks. The mic is yours, Dr. Komal.
yes, it is now my pleasure to conclude this interesting webinar on psychological aspects in OBGYN, to conclude and give my vote of thanks. I would like to specially thanks Dr. Nilesh Shah sir for throwing so much insight on this topic, which is in fact challenging for everybody, and especially for a gynecologist and for our day-to-day practice. I would like to thank our moderator, Dr. Niranjan Chavan, for excellently making it so interactive and taking almost 50 to 60 questions. So that is really a great job. I would like to thank our team Science Integra, the technical team behind it, everybody, Subbu, Session, Meenal, Gaurav, and they have done a fantastic job by uh, coordinating and making us connect with this platform with almost 2,500 plus people all over. Sun Pharma, all divisions, Spectra, Incra, Sinora, who have given our wholehearted support. And definitely I've acknowledged the Foxy app office bearers in the beginning, but this would have not been possible without the support and encouragement from Dr. Alpesh Gandhi, President Foxy, Dr. Jaideep Tang, Secretary General Foxy, Dr. Atul Ganatra, my VP in charge, and last but not the least, Dr. Sneha Venkatraman, who have made the slides and who have helped us for compiling the things. So thank you very much. It was very nice connecting with you. And this is just the beginning of our webinar, and we have an interesting lineup. And please look for the updates. We will be connecting with you soon. The next webinar would be on the 7th, that is the World Health WHO Day, and that is Health for All. And we will connect with you, and we expect you to see in the same large numbers. Thank you very much and have a good day. Thank you.